All right, so just to let you know, coming up after 8 o'clock, we'll be speaking to the Health Minister, Dr. Zweli Mkhize. You would know, of course, that Friday will mark 1 year since a hard lockdown was implemented and a national state of disaster declared here in South Africa due to the worldwide coronavirus pandemic. So the first COVID-19 case, you'd recall, was reported on March the 5th last year. So to date, the country has had over 1 million infections with over 52,000 deaths. Let's chat now to Dr. Benjamin Roberts, who is a Research Director, Developmental, Capable and Ethical State Division at the Human Sciences Research Council. A very good evening to you. Thanks indeed for your time. So, look, this Friday, obviously marking that 1 year since South Africa had implemented the lockdown, we've also just marked Human Rights Day. But how have South Africans in general felt about the restrictions and the limitations that were imposed on them?
Yes, good evening, Griselda. And I think it is an important milestone, the 1 year commemoration of the introduction of the hard lockdown, to reflect on questions related to human rights and human rights sacrifice that South Africans have had to make. We've been doing surveying during the course of the lockdown, really trying to understand the experiences and predispositions of South Africans and how they're changing as circumstances have changed over time.
Yeah.
We actually asked them a direct question, which was framed around the willingness to sacrifice select human rights in order to stop the spread of the pandemic. And what we found is in the early stage of the hard lockdown, 78% of South Africans were willing to make that, sacrifices for the greater good. That wavered very slightly in the July to September period. It reduced from 78 to 72. But by late last year and early this year, it returned to the 78% mark. So clearly what the results show is a very resolute pro-sacrifice tendency among South Africans and a willingness to endure quite significant hardships that we've seen during the lockdown and due to the restrictions. And in order for the greater good, It feeds very much into sort of an Ubuntu-style moral philosophy in society about individual versus collective need.
Dr. Roberts, on the other hand, you'd recall that during the first round of the lockdown, or right towards the beginning, if I can, there had been several challenges also to government and what it had put in place. Did that study also cover how government performed in ensuring that it kept the nation safe versus not trampling on the rights of citizens?
Yeah. So actually the performance of government and political leaders in particular in handling the pandemic has been shown to be one of the key and most decisive factors influencing the tendency for an individual to say, I would be willing to sacrifice or not.
Yeah.
So for those that believe that the president and national government were actually performing well in their decision-making and the handling of the challenges which they faced, those individuals are much more inclined to say, we believe in the need to make those kind of sacrifices and follow the kind of regulations which were implemented under the Disaster Management Act.
Yeah. And generally, in terms of human rights, given that we've also just commemorated that, is there anything in terms of that study that spoke about perhaps lessons that South Africa could have learned, given that we're going to commemorate that 1 year also on Friday? Lessons that South Africa could have learned throughout this entire period, granted that the entire world had been dealing with a pandemic of this nature for the very first time. Was there anything in the study that gave light to that?
Well, one thing we saw is if we look at the examination of sacrifice versus anti-sacrifice tendencies, that was very much informed by the kind of policies which were implemented to some degree. So we found that those that were pro-sacrifice tended to also display general positivity towards the social policy measures implemented, such as increasing the value of grants, certainly much more than those who were more circumspect about making such sacrifices. We also saw that there were some of the polarizing policies, such as the alcohol and cigarette bans, really shaped that outlook. So those that were more inclined to criticize those decisions were much more averse to making those kind of sort of abide by the lockdown regulations
Yeah.
and be willing to actually sacrifice for the greater good of our society.
Dr. Benjamin Roberts, thanks indeed for joining us on the programme. Research Director, Developmental, Capable and Ethical State Division at the Human Sciences Research Council. Take a short